Tonight, another death linked to listeria outbreak in Boar's Head Deli meats. This brings the U.S. death toll to 3 now, and an additional 9 more Americans are sick because of Boar's Head products.
Joining us to talk about foodborne illnesses and what we should be doing right now to protect ourselves, Dr. Howard Selinger from Quinnipiac University. Thanks for joining us to talk about this. We hear these 3 deaths now, dozens of illnesses, all due to deli products from Boar's Head specifically. But does that mean that we shouldn't eat any deli meat at all?
No, it doesn't. You need to understand that listeria is a bacteria. It's a more dangerous bacteria than what most Americans would experience with something like salmonella or Shigella food poisoning or a simple stomach virus. So much so that even though it's relatively rare, only 1,600 cases out of over 300 million people, 90% of those people end up getting hospitalized, unlike your typical stomach illness. And up to 18% of those people, especially the vulnerable elderly, pregnant women, and those who are immunocompromised from chronic illness, will not survive. So small prevalence of people it hits, but much more serious. And it lives on the deli meats so that you can spread this just by handling deli meat to other exposed foods in your refrigerator, in your kitchen.
And it can linger, I understand, on the deli slicers as well, so that impacts other products along with it. But when it comes to listeria specifically, doctor, what symptoms should we be looking out for? I understand flu-like symptoms is one of them. So how do you differentiate listeria symptoms versus a flu, for example?
Well, typically listeria presents not so much as a total body illness with fever, chills, and headache. It presents with nausea, vomiting, and most dramatically diarrhea. That is how listeria presents if it's going to cause symptoms at all. And in many healthy adults, and remember, only 1,600 out of 300 plus million, some may have no symptoms. It's the vulnerable populations. And it can be deadly in terms of multiplying in the liver, spreading into the bloodstream, and causing a brain infection known as meningitis and encephalitis.
Can we talk quickly about when we see those symptoms? Is this something within hours, 24 hours? How do we know?
Listeria tends to take a while to present itself. So unlike an exposure to an undercooked chicken or a virus that's living on a food group where you typically get symptoms after handling or eating that within 24 to 48 hours, this can be a number of days. It can be up to a week, and then serious illness can be even longer. So it's a little trickier, but when it hits, it's more potentially dangerous, but again, only to those who are especially vulnerable.
I guess the follow-up to that is, at what point do you have to drive yourself to the hospital? At what point does it get serious enough that you need emergency care? And also, thankfully, we have had no deaths here in Connecticut. There have been elsewhere, as we noted. But how hard is this illness to track, doctor? Is it possible that people have come down with listeria and don't even know it?
Absolutely. Many healthy people can be exposed to listeria and be nearly asymptomatic. And as to when you should drive yourself to the hospital, you should use good common sense. If you don't feel you're in complete control of your faculties, you should not be operating a motorized vehicle. If you're having persistent vomiting, diarrhea, lightheadedness, you should not be operating a motor vehicle. You would need to call 911 because, again, the numbers impacted are small, but the hospitalization and death rates are much higher than your typical stomach illness.
You answered so many of our questions that we've been asking each other in the newsroom about like when those symptoms come, and you've really helped us kind of put this into perspective. We appreciate your time, Dr. Selinger from Quinnipiac. We appreciate it.
Happy to help.
All right, have a great night. Thanks again.